Signs that may indicate a heart attack. Don't wait to get help if you experience any heart attack warning signs. Some heart attacks are sudden and intense, but others start slowly with mild pain or discomfort. Signs that may indicate a heart attack. Rapid weight gain. Anyone who finds that they have put on a lot of weight lately should reflect whether it could be due to too much food or whether it could be an indication of a heart problem. With heart disease, one of the symptoms is fluid buildup in the body. This leads to swelling and flatulence, which are noticeable as weight gain. If you notice this symptom, it is advisable to write down what you eat daily. This is how you can tell whether the increase is diet-related or not. Nausea and loss of appetite. Another sign of the risk of heart disease can also be nausea, indigestion, and loss of appetite. If this type of complaint is new, it is advisable to observe it and, if necessary, to consult a doctor. The heart is not always the problem, but another disease can also cause these symptoms, such as gastritis. However, it can also be a sign of pregnancy. The doctor knows best. Irregular heartbeat. Palpitations can have many causes. Often, it is an adrenaline rush or a change in mood that is behind it. However, anyone who feels that their heartbeat is more often irregular should urgently have this examined. The medical term for an irregular heartbeat is arrhythmia. It is important to take the problem seriously because if left untreated, an arrhythmia can lead to a stroke. It is advisable to consult a doctor if you experience this symptom. Persistent coughing. Stubborn cough can be annoying. Many do not take this seriously, but prolonged coughing can indicate heart disease. When the heart has trouble getting blood to the body, it can get to the lungs and cause a persistent cough. If you have a cough with sputum, you should definitely pay attention to the color. One should be careful with pink-white sputum. If the cough intensifies at night from lying down, this is another warning sign of heart disease. Cold sweat. Cold sweats are a warning sign from the body. Usually, the body regulates its temperature by sweating. When you sweat excessively, the heart works harder and pumps more blood through the arteries. Anyone who frequently suffers from cold sweats should not hesitate to consult a doctor as soon as possible. Cold sweats can be a sign of not only heart disease, but also an infection, cancer, or neurological disease. Medication or stress can also cause cold sweats. Swelling of the legs. Swollen legs are bothersome and painful. It is not uncommon, especially in summer. However, if you often suffer from swollen legs, you should keep this in mind because it can be an indication of a heart disease. Edema is often due to fluid retention. Often, the legs and feet are most affected because they are furthest from the heart, and that is where the blood circulates first. If swelling does not go away or even worsens, you should see a doctor immediately. Sleeping disorder. In most cases, sleep disorders are treatable and harmless. In many cases, however, a heart problem can also be the cause. It is therefore important to take insomnia seriously because lack of sleep can lead to many diseases. For people who have problems falling asleep or staying asleep, it is advisable to consult a doctor. Difficulty breathing while sleeping can indicate fluid in the lungs. Chest pain can also often be the cause of palpitations. The information on the Fine Health channel is offered solely for general and educational reasons and does not replace professional medical guidance or treatment. For any ailments or medical concerns you may have, please get advice from a physician. Inflammation of the gums. Usually, gingivitis is not a cause for concern. However, if the pain in the mouth accumulates, it should be checked by a dentist. Often, heart problems can be a cause. It initially manifests itself with an inflamed palate, which is an indication of batteries in the bloodstream. The bacteria can cause blood clots. What many do not realize is that dental and heart health are often interrelated. Dental health can affect the whole body, so it is important to have your teeth checked regularly. Snoring. You usually don't even notice that you are snoring. Only the people around you point it out. Sleep apnea is the medical term for it. It's not uncommon now. The heart stops for a moment and then resumes its normal beat. Those affected do not notice anything, and precisely because of this, it is important to be vigilant and to go to the doctor once too much rather than too little. If recognized early, a heart problem can also be treated. Pain in the upper body and arms. Often the first thought when there is pain in the upper body and arms is that there is tension, but it can also be a sign of a heart attack. There is no specific point at which the pain of a heart attack begins. It depends on the affected area. Then the pain usually radiates to the left, but often also to the right arm. You can often feel the pain in your mouth or back. The signs of a heart attack are often more difficult to read in women than in men. Shortness of breath. Many think the shortness of breath has something to do with being overweight. However, it does not have to be. If you get short of breath, even though you did not do anything particularly exhausting, this could be a sign of a panic attack or a heart attack. If the airways and the cardiovascular system are not working together in a balanced way, then it can be a warning sign of an existing or impending heart problem. In this case, the lungs lack air and it is difficult to breathe. Chest pain. Chest pain is one of the classic warning signs of heart disease or a heart attack. If the pain is accompanied by difficulty breathing, then the greatest caution should be exercised. If the pain comes suddenly and without warning, it is best to go to the emergency room immediately. The pains are different. A feeling of tightness or burning pain can also occur. If the symptoms appear in a resting state and last for a few minutes, then this can be rated as a heart attack. Immediate medical attention is vital. Open wounds on the feet. Open wounds should always be treated as they can become infected quickly. Care should be taken if the wounds or ulcers do not heal on their own or are difficult to heal. This can be a sign of aortoiliac disease. It is a blockage of the aorta. This disease can lead to ischemia, which means a decrease in blood and oxygen supply to tissues. This can result in tissue death and, in the worst case, loss of a limb. Pain in the toes. Toe pain may seem harmless at first, but it is not. If you have pain in your toes when you are resting, and it is definitely not due to tight shoes, then you should get to the bottom of the cause. It can also be a sign of aortoiliac occlusive disease. The best thing is to clarify the symptoms with the doctor and rule out a heart problem. This is the only way to treat a serious illness in time. Cramps in the thighs and buttocks. Magnesium deficiency is often the cause of cramps. Cold or intense, extreme exertion can also lead to cramps. Often, however, there is also a heart disease behind it. If you feel severe pain or cramps in your thighs, buttocks, or calves during normal walking, you should, to be on the safe side, see a doctor. It can also be a sign of aortoiliac occlusive disease, according to the University of Pittsburgh Medical Center, UPMC. A doctor can provide certainty here. No hair growth on the legs. A lack or poor hair growth on the legs can be a sign of peripheral arterial disease. This is a circulatory disease in which plaque builds up in the arteries and reduces blood flow to the limbs. One symptom of this is hair loss on the legs, according to the McLeod Health Service in South Carolina. So, if you find that your hair is suddenly falling out, it can be a sign of heart disease. Sputum when coughing. Frequent coughing with sputum can be a symptom of an illness. Here, it depends on the color of the sputum. If the color is pinkish white, it could indicate a buildup of fluid in the lungs. It's a common warning sign of heart disease, according to the American Heart Association. Often, it is just a simple cold, but to be really sure, you should consult a doctor. They will do tests to find out the cause of the discomfort and rule out the worst. Interrupted sleep. If you get up often at night to go to the toilet, you should try not to drink too much before sleeping, but it is important to keep an eye on the problem. If it doesn't get better, a doctor should be consulted. According to the study, An increased urge to urinate is a symptom of heart failure. To rule this out, you should go to the doctor for a checkup and not ignore it. Chest discomfort. Chest discomfort can be caused by several causes. Reflux after eating fatty foods, for example. However, if the chest discomfort persists, it can also be a harbinger of an impending heart attack. The American Heart Association recommends that you see a doctor or even the emergency room as a precaution instead of waiting for the pain to go away on its own. It is easy to overlook the signs of a heart attack, and help often comes too late. Erectile dysfunction. Erectile dysfunction can be very stressful for men. One cause of erectile dysfunction can be a heart problem. Harvard Medical School explains that an erection requires an extra blood supply. If the arteries are calcified, the blood flow is interrupted. If you or your partner suffer from erectile dysfunction, it is important and advisable to consult a doctor. If necessary, he will refer you to a specialist. Treated in good time, other diseases can also be ruled out. Confusion and forgetfulness. Forgetfulness and confusion can have many causes. The American Heart Association states that levels of certain chemicals in the blood can cause changes in sodium levels. This leads to confusion and also memory loss. Malnutrition, fatigue, and lack of vitamins and minerals can also cause the problem. Of course, it is better to rule out heart disease and to consult a doctor, because only he can carry out the necessary tests to rule out or avoid worse. Panic attacks. Heart attacks and panic attacks are easily mistaken because the symptoms are very similar. Both are noticeable through malaise, shortness of breath, fear, tightness in the chest, and sweating. The heart rate increases, dizziness, and physical weakness are further signs of a heart attack and a panic attack. It is really important to clarify that it is not a heart attack. A professional medical diagnosis can help, and the problem, whether it's a panic attack or something else, can be treated. Sudden tenderness in the breast. Chest pressure and pain can be a warning sign of an impending heart attack. With atrial fibrillation, you can feel a dull, painful feeling in your chest. If you feel this, you should see a doctor urgently and as soon as possible. People with atrial fibrillation are at increased risk of stroke. You shouldn't waste any time and act as quickly as possible. Even if the problem rarely occurs, but recurs, you should contact a doctor. Difficulty of breathing. If you have difficulty breathing, especially when you are resting, this is a serious symptom. At rest, the muscles are relaxed, so you should not feel any discomfort when breathing. If you have breathing problems while sleeping, lying down, or even during light activities, you should consult a doctor as soon as possible. According to the American Heart Association, heart disease can be present if the blood pools in the veins because it cannot follow any other flow. This leads to fluid in the lungs and therefore results in heart problems. Sudden migraine. Migraines are no longer uncommon. However, migraines can have many causes. What many people do not know is that migraines can also be an indication of heart disease. This type of pain can be indicative of a stroke or even a blood clot. If you suffer from vomiting and dizziness in addition to the pain, then there is no time to lose, and you should go to the emergency room immediately. Every minute counts here. Back pain. Unfortunately, many people today suffer from back pain. It has now become a real widespread disease. However, some do not know that back pain can be an indicator of heart problems. If the pain is in the lower or upper back, or if it starts in the chest, this can be a sign of an impending heart attack. In women, in particular, the symptoms and signs are more difficult to recognize than in men. Regardless of whether you have a heart problem or something orthopedic, only a doctor can really help. Thank you for watching. Subscribe to our channel and hit the bell icon for more informative videos.